service, virtual village hall. Hi there. It's great to have you. Thank you so much to RVS for inviting me back. I actually was here last year as well for Mindspace Week, and it's great to be back talking about obviously a really interesting topic and really relevant topic because it is Black History Month. Talking about the topic of Black health, and I'll get into that shortly. What that means to me, really. And just to sort of give you a heads up, this talk's going to go on for an hour, but the last 10-15 minutes will be an opportunity for you to ask questions, and for me to answer those questions, or actually anybody else in this forum to answer questions as well. So please do feel free to submit any questions throughout the duration of the talk, and I'm unlikely to pick them up at the time, but we will come back to them at the end. So welcome to everybody who's joining us live, but also welcome to all the people who are probably going to watch this back at a later day. It's really great to be here with you. A little bit about me. My name is Dr Zoe Williams. I'm an NHS GP. I work in Southwark in South East London as a GP, and I have various other roles as well. So my area of interest, my sort of real area of passion, is all around physical activity and health, and that's actually what I spoke about at this event last year. So I have roles with Public Health England. It's not called Public Health England anymore, but people still know it as that. It's called OHID. Have roles with the Royal College of GPs, and I'm a director of the British Society of Lifestyle Medicine, and those roles are all around trying to encourage healthcare professionals mostly to encourage their patients to improve their lifestyles and be more active, and support them to do so. I also have a role in the media, so I work on This Morning and various other TV shows as well. And I also am the founder of a charity called Fit for Life, and we work with young people from disadvantaged backgrounds. We co-create sporting activities with them and provide mentors for them. So I do various different things. But another thing that I am really passionate about is health inequalities generally. And one of the things I always find really, really interesting is the fact that actually, if we can improve the health of those with the poorest health, then actually the health of the whole nation can get better. So I'm going to share some slides with you now. Hopefully this will go smoothly. Okay, so hopefully you should be able to see me and see the slide there. So I'm going to talk a bit about health inequalities and specifically how that affects the Black community. We're all one human race. We're all the same, but we don't necessarily experience the world the same. And the colour of our skin can have a huge impact on how we experience the world and how the world experiences us. And Black people do experience systemic racism. Black people do get treated differently across the whole system, by the criminal justice system, by the legal system, by housing, and actually by healthcare as well. And we're learning more and more about that, and things are starting to change. It's really positive. But just a few things to share here, a few specific things, is that Black people report living with poorer health. They report poorer experiences of healthcare services. Just a few specifics. Black people are 3 times as likely to experience homelessness and 4 times as likely to be detained under the Mental Health Act. Structural racism can reinforce inequalities, and we definitely do see that in things like access to housing, employment, how people are treated by the criminal justice system. But racism and discrimination can also have a negative direct impact on a person's physical and their mental health. There's something that I wanted to, before I go any further, just share, because I think, most people do now understand what is meant by Black Lives Matter. And obviously a couple of years ago, there's been a movement there for a long time, but this movement really gathered a lot of steam because of that dreadful video that we all saw of a black man being murdered in plain daylight, George Floyd. And it's undeniable that if his skin had been white, that wouldn't have happened. But I think sometimes for anybody watching this, if you encounter people, there is still some confusion out there about this term Black Lives Matter. So I thought I'd just share this little cartoon that I've sometimes used to explain to people, and I think it's quite a nice way of explaining to your family, friends, colleagues, if you come across people who don't quite get it, why Black Lives Matter is such a valid statement. So in this little cartoon here, what we have at the top left there is somebody saying that actually they think that all lives matter, and that we should care exactly equally at all times about everything. So if we make the analogy of houses, and in the third picture you can see that there are two houses. There's one that's on fire and there's one that isn't on fire, and the statement there is that all houses matter. So it says, then I agree, all houses do matter, but at the moment the one on fire should get the attention. But by saying that a burning house needs attention, aren't you saying that the other houses don't matter? No. Well, my house isn't on fire, but I have dry rot. Are you saying it shouldn't be fixed? Well, it should be fixed, but the fire is more pressing. Let's say I put that fire out, but my house catches on fire. Aren't I entitled to water then? Of course, but that's not the situation. That's not the one on fire right now. My house is near to the fire. If I wet it down, then the embers won't catch. Is that sensible? That's completely outside of the analogy. So it's, and then that's what, where the house is on anyway, why do I got to hose it down for him? He died in the fire. So it's just a little analogy that explains that the Black Lives Matter slogan is not saying that anybody else's life doesn't matter. What it's saying is what we're seeing, what we definitely saw that really vivid and gruesome example of in 2020 was that at the moment, there's real evidence out there that Black people and Black lives are struggling, and there is disjustice, and we see that in healthcare. So Black Lives Matter doesn't mean that anybody else's life doesn't matter. It means that at the moment, that's where the attention needs to be. Another way I've explained it too is a doctor. If I go out to my waiting room and there are 6 patients sat there, and one of them has cut their finger and it's bleeding, and I have one plaster, me giving that plaster to the bleeding person doesn't mean that the other people don't matter. It's just that that's where the need is at the moment. So I thought I'd just explain that because it can be quite a helpful way of explaining it. Thinking about healthcare and thinking about illness and disease, here is a list of diseases that disproportionately affect Black people. So heart disease, type 2 diabetes, stroke, high blood pressure, myeloma, which is a type of blood cancer, and prostate cancer is twice as common in Black men than white men. Bowel cancer and breast cancer are interesting because they don't necessarily they're not necessarily more prevalent in Black people, but Black people are more likely still to die of them. And in I've been doing quite a bit of work within the breast cancer community recently, and I did a roundtable quite recently with a group of Black women who've all been affected by breast cancer. And we were looking at this. We were looking at, well, why is it that even though breast cancer actually affects Black women slightly less in terms of how likely they are to get it, still they're more proportionally at higher risk of dying. They're more likely to present later, and they're also more likely to have more advanced disease. And it was a really interesting chat. In fact, we spent about 2 hours talking about it. And as the only doctor in the room and the only person who hasn't had breast cancer, I remember thinking, I just really, really wish that every single healthcare professional in the world could have eavesdropped on that conversation, because it was just so interesting and really complex. Things from the stigma within the Black community to Black women are less likely to be self-checking their breasts, to Black women are less likely to attend screening appointments, to things like, we're just less likely to talk about it. And there is still sometimes within the community some shame around things like cancer and a belief that, we should keep these things secret. There were so many things that came up. It was so interesting. But also, what was undeniably a big part of it was the experiences actually that Black women had on their breast cancer journey, from diagnosis through to treatment, all the way through to things like prosthetics. And the world of breast cancer is forever changing, and it's a positive story in that more people survive breast cancer than ever before. And in a disease that used to be the predominant focus was on survival, now the focus is on survival, but also people living well with good quality of life after their breast cancer. So things like prosthetics, things like fake nipples, all of these types of things, wigs, are really important. And what I discovered in this room was that even though we live in a society with people with all different skin colours, actually most of these women were being offered straight hair wigs and white prosthetics. And it, really impacted on their experience. And the last one on that list there is COVID-19. So why is it that these diseases, these types of cancer, affect Black people more than white people, and often people from other ethnic backgrounds as well? And just to say, there are certain types of cancer and certain diseases that actually affect white people more or affect Asian people more. But the focus today is on Black health, which is why we're highlighting these. Well, the causes are really complex. Genetics plays a role. Our lifestyles play a role, everything from the types of foods that we eat to how much money we have, and therefore our access to healthy foods, to physical activity, whether we smoke, how much alcohol we drink, all these things make a difference. Access to services is a huge one, and the data tells us that whilst irrespective of your race, there is pretty equitable access to primary care, so GP services. Actually, when it comes to services beyond that, so it becomes to hospital care, secondary care, or things like accessing mental health support, psychological support, even stop smoking services, then actually people living in areas of deprivation and people from minor ethnic backgrounds and the Black community report having poorer access to services. The other reasons are around cultural differences, sometimes religious reasons. And actually what we know is that Black people may be less vigilant and may be likely to present later to healthcare services. Studies have shown that white people are generally more likely to attend screening, cancer screening, but also the standard of care that people receive varies dependent upon race as well. So what action can we take? Well, I really, really believe that knowledge is power. I think the fact that we're having this conversation, when I say conversation, it's just me talking at the moment, but please do keep submitting those questions in the comment section so we can come to them later and turn it into more of a conversation. But knowledge is power. And I think, just recognizing that whilst we are all one human race, we do experience the world differently. There are differences, and the healthcare system has actually been set up by white men for white men. And, this year there's been a lot of work looking at how actually women, just women generally, are getting a raw deal when it comes to the healthcare that we receive in this country. But also Black people and people from other minor ethnic backgrounds as well are getting a raw deal. So the first thing to do is, educate ourselves, have this knowledge, have these conversations, start talking about it, and change is happening, it is starting. But the more of us that are involved in these conversations and involved in that change, the better. We need to make sure that we're taking healthcare to the people in the right way that's appropriate for them. I work with a man called Lord Victor Adebowale, who he's done a lot of work in this country for trying to reduce health inequalities. But interestingly, he talks about health inequity. because the word inequality and the word equity are different. And he said, actually, we've got it wrong. We shouldn't be trying to eliminate health inequalities. We should be trying to make healthcare equitable for everybody. Now, the differences between them are, so he gives this little analogy, I love an analogy, where he says, if you have 3 people of different heights and they're all trying to see over a fence, so you have a very tall person, an average sized person and a small person, and they're all trying to see over the fence. As the current situation stands, the tall person can easily see over the fence. The person in the middle, if they're really strained and go on their tiptoes, they can just about see over the fence. And the smaller person, no matter what they do, they can't see. Health inequalities means you give everybody the same. So if you give them all the same size box, well, the person who was tall didn't need the box anyway. So it's pointless. It's a waste of money. The person in the middle can now comfortably see over the fence. That's great for them, but the smaller person still can't see. Whereas health equity, thinking about what's equitable, is you give the person what they need in order to give them all the same opportunity. So in this scenario, the tall person wouldn't receive anything because they're fine, they don't need it. The person in the middle would receive the box, and the person who's smaller would receive 2 boxes. So you've got the same resources, but you've given them out in a different way so that everybody now has the same chance and the same opportunity. And that's kind of, it's a conversation that doesn't really happen within healthcare. We still talk about health inequality. Whereas what we need to do is we need to recognise that some people in society need a lot more support and actually need better access to healthcare. But yet we still live in a world where people who have less need for better resources in healthcare still get more than those that need it the most. So we need to take the healthcare to the people, but we also need the people to come to the healthcare. And what I mean by that is we need to educate and activate and enable people to seek healthcare at the appropriate time. So anybody, if they feel a breast lump, should go straight to their GP, but we know that some people are more likely to delay. Anybody who is offered screening, cancer screening, cervical screening, breast mammograms, bowel cancer screening, anybody should take up that screening offer straight away. But we know that some people do more than others. So we need to enable people to access healthcare more appropriately. I think a lot of us need to have conversations with relatives. A lot of us from the Black community, if we are younger, we might feel that these issues don't affect us that much, but we may have older relatives who we feel that it does, and we need to be able to start having conversations with relatives. So I've got a couple of slides coming up on how we can approach that. And we definitely need Black and Asian people in this country to be participating in health trials so that medical research will be based on data that comes from the whole population. At the moment, what we know is the majority of research, health research, drug research, has been done with white people and again with white men. So the data means that we're prescribing and we are developing services and we're developing treatments and surgical techniques that best suit white men. But in order to make sure that it more represents the country, we need to make sure that everybody's taking part in research. So I want to talk now a little bit about health hesitancy, because I've had lots of conversations, especially triggered by the COVID-19 pandemic, especially triggered by the vaccine hesitancy, which isn't really that much of a problem now, but definitely was at the beginning of the vaccination programme. So I've had lots of talks about health hesitancy generally. And I feel like it's something that's often swept under the carpet. If people if people are vaccine hesitant, they're not so sure about having their vaccine, then, it's like, obviously it's a person's personal choice. But I feel that we should do more. We should be looking to understand more why that is. And what's come up again and again and again is that particularly within the Black community, there is a lot of distrust of healthcare services, of the healthcare establishment. And rather than just saying to people, well, actually, you should trust them and you should get the vaccine and this is the right thing to do. I think we need to educate ourselves as to where that distrust comes from, and is it just? And if we can understand it and we can empathise, then we can advise people in a way that you know, they're more likely to listen. And you know, at the end of the day, we still need to respect their wishes. So I started doing some research myself. I knew that even within my own family, there is this general distrust about healthcare services. My dad's Jamaican, and my Jamaican grandmother was a midwife. She worked in the healthcare service, but still, I know there's this hesitancy and this distrust. So I wanted to be curious about it and find out a bit more about it. And I discovered that actually a lot of people have distrust with good reason because of things that have happened in the past. And that things continue. So I'm going to take you over a few slides, a little bit of Black history in healthcare. So back in the 1840s, which is a very long time ago, there was a physician called James Marion Sims. And he conducted experimental gynecological surgery on female Black slaves. So this is back in the times of slavery, and he was trying to discover new techniques. A lot of his techniques were for urinary incontinence, so that he could use these techniques to improve the health of white women. So in order to perfect his techniques, he actually did experimental surgery on Black women, often without anaesthesia, and often by using physical, essentially they were pinned down, and he did these surgical procedures with no anaesthesia. So, you know, that was back in the 1840s. We'll come a little bit more recent than that. So 1932 to 1972, there was an experiment in the United States called the Tuskegee Experiment. And this was at a time when there was no treatment for syphilis. And so what the American healthcare public health services did is they recruited 600 African-American men in Alabama. And they recruited them under the pretense that they were going to give them treatment for their syphilis. Whereas actually what they knew all along is that they were going to make sure that they didn't have any treatment for syphilis. They were going to purposefully withhold treatment and make sure that they didn't access any treatment from anywhere else, as a way of understanding exactly what happens throughout the course of syphilis, and specifically what happens to the human brain eventually if a person is left without treatment. So, you know, that was something that happened actually not that long ago. If we come more recent than that, in 1996, so this is well within my lifetime, Pfizer. There was particularly, I experienced amongst my patients, I work in a part of London where a large proportion of our patients are from the Black community, and a lot of my patients, when the vaccines came around, didn't want to have the Pfizer vaccine. And I didn't understand why that was, but I discovered that this happened, and it really helped me understand. So Pfizer, which is one of the largest pharmaceutical companies in the world, in 1996, they conducted a clinical trial in Nigeria. And this trial, they developed a new antibiotic, which they thought would be, which they wanted to use as a treatment for meningitis. So they recruited families with children who had meningitis to this study. And instead of giving them the gold standard antibiotic, an antibiotic called ceftriaxone, which we know is the best treatment for meningitis, they gave children the new experimental antibiotic, which turned out to not be as good. And a lot of children, some children died, and a lot of children ended up with disabilities. Now, the issue here is they did not consent the families properly. They did not inform them properly. The families were led to believe that their children would be receiving optimal treatment. And actually, there was in The Guardian back in 2011, it showed here that Pfizer announced it had made payments of $175,000 to each family that was affected, and at that time more compensation settlements were expected. So therefore, all of a sudden I'm like, okay, right, I get it. I understand why some of my patients, who are particularly African patients, especially from Nigeria, they have distrust of Pfizer. It's like, well, No wonder if they know about this, or even if they don't know about this, it may be that their family or their extended family are saying, no, 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 don't do anything that's from Pfizer. They might not know the ins and outs, but that distrust is still there. Fast forward to 2021, and Public Health England released this document which shows that COVID-19 disproportionately affects people of colour. They looked into some of the complex reasons why. Again, a lot of it came down to people from certain ethnic backgrounds were less likely to engage healthcare services in a timely manner. They were more likely to sit at home getting more unwell until the disease progressed to a very severe level. Again, a lot of distrust about how they would be treated compared to other people, their white counterparts, if they did go into hospital. And 2021, so, modern day, Black women are 4 times more likely to die in childbirth. And again, it's really, really complex reasons behind this. But something that stands out yet again is Black women reporting the way that they're being treated in maternity units, and therefore often less likely to attend all of their ultrasound and screening appointments because of the treatment that they've received. So I think we can kind of start to understand why there is some distrust, and understanding that, knowledge is always power. So the way I've advising people, if we have relatives, if we have loved ones, if we have work colleagues who, if we're worried about their health, if they're worried about their health, but they're not seeking help and attention, it's always best to, first of all, just explore why, and never tell somebody they're silly for having these concerns, because often they have these concerns with very good reason. So before I come back to you and we can talk about this in a bit more detail, I wanted to share with you a couple of tips and tricks that I think we can all do to look after our own mental health and well-being. And the first one is this. It's a technique called box breathing. It's one of my favourite techniques. I do it all the time. I do it sometimes between patients if I'm feeling stressed, if I'm feeling overwhelmed. So I thought maybe we can do a couple of rounds of this together now, and just I want you to reflect afterwards on how you feel. So the technique, I'll explain it first and then we can do it. So you can see that there's a box there on the screen, and the idea is that you start off by breathing in very slowly for 4 seconds. You hold your breath for 4 seconds, then you breathe out for 4 seconds, and then you hold your breath for 4 seconds. So maybe we can do 3 rounds of this together once it gets back to the top. So breathe in. So we're going to start in 4 seconds with the deep breath in. Everybody ready? Breathe in. Hold. Breathe out. And hold. Let's do 2 more rounds together. I wonder how you're all feeling after that. I'm feeling, after talking for the last half an hour, a little bit calmer just after doing that little exercise. So that's just something I want to share with everybody on this Mindspace week. And then there's one mindfulness technique that I want to share with you as well. I think mindfulness is a really great technique. I know that over the course of this week, there will be more mindfulness opportunities made available to you, and meditation and gentle exercise and healthy cooking as well. There are lots of different ways to be mindful. Essentially, mindfulness is bringing yourself to the present moment, because all of us have these busy, crazy lives where even in the last hour, you've probably had more than 1,000 thoughts running through your mind, things you need to do, things that happened yesterday, things that happened a year ago, planning, preparing, sorting out this, that, and the other. So the act of mindfulness is just bringing yourself to the present moment. So this is one little technique that I really like, where you utilize your senses to bring you back to the present moment. You can do it anywhere. You can do it at work, you can do it on the bus, you you do it in bed. So what I want you all to do now is have a look around you and just think about 5 different things that you can see. So for me, I can see the window, I can see the house across the street, I can see my screen, I can see my fingers, and I can see 3 fingernails because my false nails have fallen off for 3 fingers. So just think about 5 things you can see. And then 4 things you can hear. So I can hear my own voice. I can hear the hum of the computer. I can hear a car going past outside. And I can hear my chair slightly creaking. It's 4 things you can hear. 3 things you can feel. So I can feel my bum on the seat. The tips of my fingers are quite cold. I can feel those on my arm. And I can feel the air as it goes into my nose. 2 things you can smell. I can smell the remains of the coffee in my cup. And I can just about smell the candle that I have over on the fireplace. And then 1 thing you can taste. I can still taste my coffee. So that's something you can do anywhere that just brings you into the present moment and just really just blocks out all the noise. And 2 little techniques I wanted to share before I come back to you. So I'm going to stop sharing my screen now. So that whole time I could only see my slides, so I couldn't see anything else. Reminder, do please ask any questions in the comments section and then we can get to those. And in the meantime, I think another important thing that I wanted to share with you is thinking about having conversations with our relatives, with our loved ones, around mental health, because one of the things that we definitely see disparities in within the Black community is with mental health, in how we experience mental health conditions. That's a really important one. People from different cultural backgrounds, people from different ethnic backgrounds, people from different families, people of different religions actually experience mental health illness in different ways, and it manifests itself in different ways and it presents in different ways. And this is another downfall sometimes of the mental health services, is that we are taught in medical school that if somebody is depressed, for example, then these are the signs and symptoms of depression. But again, all that research and those studies have been done with white people, and they can be different for different groups of people. So I've got something on my phone here. This is from the Black Minds Matter website, and they have some really good resources on how to start a conversation. So they say how to encourage conversations on mental health in Black households. They've got 4 tips. The first tip is checking in. So always checking in with people, whether you think people are struggling or they're not, just genuinely asking that question that we hear all the time: how are you? But how are you really? Around the dinner table, in the car is a really good time to have conversations, especially with your children. If you're worried about children, I hear from some of the parent forums that I've been working in that if you have a car and if you drive, say, for example, for the school run, it's a really good opportunity to have some of those more difficult conversations because it's a bit of a less intense environment. The eye contact's taken out of it. They can look out the window. They have a bit more time to think. But regularly checking in is the only way that we will know if the people we care about are okay. The second one is engage and be present. So be present in conversations. So that means if you are bringing up a conversation about mental health or anything else that can be quite delicate, make sure your phone's out of the way, make sure the TV's off. You can have a bit of distraction, music, something like that, but trying to make sure that that person knows that you are really attentive and listening. The third one is showing compassion. And sometimes these conversations can be difficult for the person raising the conversation, and also difficult for the person we're having the conversation with. So showing compassion and trying to understand their experience from their point of view rather than your own point of view can be really helpful. A really helpful tip, actually, something that we often do as doctors, is if somebody's shared something with you that you think is quite important, or you think it was quite difficult for them to share, just reflecting it back to them. So rather than asking them a specific question or giving a comment or giving an opinion, say, for example, somebody says, yeah, Dad, I have been feeling sad. You can simply just say, you've been feeling sad. And make that the question, reflect it back to them. That gives them an opportunity to open up further, and it shows that you've listened, and it shows compassion. And use open-ended questions as well. So how are you is a really good one. Is there anything I can do? What can I do to support you, rather than do you want me to do this? Do you want me to do that? What has been going on? Can you tell me more? Open-ended questions. So I think that's a really useful resource. So that's on the Black Minds Matter website, which is something that I found that I thought would be useful to share. And then over to you guys for questions and comments. So let's start having a look here. Good morning, morning. Okay. Where does Dr. Williams see the role of social prescribing playing in addressing health issues in the Black community? Great question. So for those that aren't aware, what is social prescribing? Social prescribing is something that healthcare services have always done, but in the past couple of years, we are definitely thinking about it more effectively. When you think of a prescription, we tend to think of a piece of paper with that the doctor has prescribed medication, which you take to the pharmacy and then you take a pill. A social prescription is when a doctor or a nurse or another healthcare professional or somebody working with a healthcare professional team gives you kind of a prescription, in that it's a recommendation of something that can improve your health, but it's not drugs. It could be anything from gardening to singing to a walking group to a therapy group. It could be helping you make an appointment at the job centre, citizens advice. It could be, helping you get some specific advice around housing. So it's recognising that when it comes to a person's health, so much of that cannot be fixed with medication. And actually, the local community and the people working in the community outside of the NHS and the specific healthcare resources have a huge role to play in helping a person with their health. A couple of examples of how somebody might receive a social prescription. One example would be asthma. So whilst an asthma patient might receive a drug prescription for their inhalers, they may also receive a referral or a recommendation or signposting to a local singing group, which is specifically for people with lung conditions. By singing, how can that improve a person's asthma? Well, from a physical point of view, if somebody starts to learn to control their breathing, control their breath, and actually increases their lung volume and capacity by singing, well, that can physically help improve their asthma symptoms. But also, being as part of a group with other people who have the same condition can give them that emotional support, mental health support. But also, we recognise that as doctors, yes, we're experts, but actually patients are experts as well. And often some of the best tips and tricks that people can get for how to manage their condition comes from other people who have the same lived experience. So that's an example of a social prescription. So back to the question, now I've explained what it is. Where do I see the role of social prescribing playing in addressing issues in the Black community? Well, I think it plays a huge role. Where I work as a GP in Southwark, we are definitely seeing a lot of community services within the Black community being upskilled, being invested in. and people utilising them more, as we recognise that social prescribing is so important. I think that sometimes Black people require interventions, non-medical interventions, with other people that have had similar experiences. So I think I am a supporter that, there should be groups that exist only for Black people, because we have this different lived experience. And that was really evident in this. I spoke about this breast cancer roundtable that I attended recently. And I saw that in action, that there was a conversation. There were white people in the room because this was something that was being recorded, it was being filmed, and it was being supported by organisations, and they had representatives there. But those people, stepped at the back and were out of the way. And these women, these Black women, spoke in the room as if they weren't there. And they spoke about things that they wouldn't have felt comfortable speaking about if it wasn't a Black women only group. So I think, it is important that there are spaces made available for people who have a very different lived experience to white people, because it's only when those forums exist that things that do need to come to the fore can come to the fore. I hope that answers your question. Her slides aren't moving on. Oh, I hope my slides did my slides not move on? Pursed lip breathing. Yeah, pursed lip breathing is also really helpful. Pursed lip breathing is particularly helpful for people who have panic attacks. Sometimes when people have a panic attack, because they breathe so heavily and hyperventilate, they breathe out too much carbon dioxide, and that can cause a lot of symptoms. It can cause dizziness, it can cause you to feel faint, tingling of the fingers. So pursed lip breathing, which is controls the amount of carbon dioxide that you breathe out, a bit like breathing into a paper bag, or you can do sort of breathing into your hands like that. That was really helpful. Thank you very much. I work in public health. Our cultural healthy food events have been very successful in raising and addressing issues in the Black community, such as diabetes awareness and being active. Yeah, that's really great to hear. There was a small amount of funding from our CCG, I remember a few years ago, that hadn't been used, and it needed to be utilised. It was for lifestyle medicine. So we put on we have one of our practices. I work across 3 practices, but one of our practices is quite a large space. So we put on these cookery classes, advertised it, thinking they wouldn't be that well attended. And I think there was space for about 20 people to come along. On the first one, over 50 people attended, and we couldn't fit everybody in the room. So it was a really relatively cheap way of delivering what is a social prescription, and something that people really, really loved. I think we talk more and more about the importance of healthy nutrition, and there are lots of the NHS better health resources that are available online are being really well utilised, and thinking about improving the quality of nutrition, but also about weight management. But actually, I think wherever you are, wherever you work in that local community, generally needs something quite bespoke. So, people, I remember those cookery classes, they were led by members of the Black community, but they were for anybody to attend. And they were really well attended by people from the Black community, but also white people and Asian people, and looking at using cooking techniques that are culturally relevant. But everybody was interested, and I think this afternoon on the virtual village hall, there's some cookery classes coming up. So if you're not aware of that, do look into that and maybe have a think about attending. Any last questions? So because we've got just a little bit of time left, I think I'll just spend 5 minutes talking about physical activity, if that's okay, because it is my special area of interest and it's what I like to talk about. And I think sometimes physical activity and exercise can get a bit of bit of a bad rap because people think that means you have to buy Lycra or get a gym membership or go out running. Whereas actually what we know is that, especially for people who are doing no physical activity or doing relatively small amounts of physical activity, there are huge health benefits to be had from just doing a little bit more than you're doing already. So if you're somebody who does nothing at all, absolute zero, if you can do a 10-minute walk once a week, then that is enough to give you health benefit. So in order to get the best, all of the health benefits from exercise, the guidelines recommend that we aim to do at least 150 minutes per week of moderate intensity exercise. So moderate intensity means that your body gets warmer, your heart beats faster, and you get a little bit out of breath, but still able to have a conversation. And 150 minutes can sound like a lot, but if you break that down, if you do it, spread it out over the course of the week, it's about 22 minutes a day. So for most of us, that's a brisk walk. So if we, for example, use public transport to get to work, a lot of us will be doing that already, but we might not be doing it at a pace that really gets our heart rate up and gets us a bit out of breath. So for a lot of people, it's doing what you're already doing, but increasing the pace. And for people who don't do that, say, for example, the bus stop is directly outside your door, just walking to the next bus stop and making a habit of doing that on the way to work and on the way back from work. That's not going to work for everybody, but just as an example, that could be enough to get those 150 minutes. And it doesn't have to be walking. It can be absolutely anything that gets your body into that state where you're warmer, heart's beating faster, and a little bit out of breath. It could be hoovering and doing it, putting the tunes on and hoovering to the point where you break out in a sweat, playing with your children, playing with your grandchildren, running around with them. It could be gardening. But also, in addition to the 150 minutes, it's really important that we do some strength exercises as well. So that could be lifting heavy shopping bags, absolutely counts. So anything that makes your muscles feel like you have to take a break and stop and put the bags down, that counts as muscle strengthening exercise. That actually counts as weightlifting. But doing some simple resistance training exercise. And I often, the simplest thing I often describe to my patients is if there's, in fact, maybe we can do this now. We see so many back problems, hip problems, knee problems. And one of the best ways to strengthen the biggest muscles in your body is simply to go from a sitting position to a standing position. So if everyone can just, wherever you are, if you're sat down, just stand up. And what I say to my patients then is, and then sit down again, and then stand up again, and then sit down again, and then stand up again, and then sit down again. You get the message. So doing, for somebody who finds that quite difficult, doing sit to stand 10 times a day and gradually trying to build that up to ideally 50 times a day. That could be for people, who have mobility issues, who, find walking quite difficult, but they are able to stand. That can start to overcome a lot of problems with joint pain in the knees, for example. Doing something similar with your arms, just simple things like tins of beans or bottles of water, and exercising your arms in all directions. So thinking about going up, thinking about moving the shoulders out to the sides, moving them forwards, rotating, but as much as anything, just getting the upper body moving the neck as well, and trying to keep the body moving. But muscle strengthening exercise for people who are able to do a bit more. Simple things like squats whilst you're boiling the kettle, lunges, press-ups on the kitchen bench. And I often think the kitchen is a time where, if you drink lots of cups of tea, I do, the kettle takes about 2 to 3 minutes to boil. If you do three sets of 3 minutes of weight training exercises that make your muscles really feel like they've worked, that's more than sufficient. And trying to do that a few times a week. So the key message is, when it comes to physical activity, if you're already doing loads of it, great, carry on, and hope you enjoy it. If you're only doing a little bit, increasing it towards that 150 minutes, if you can, will give you huge health benefits. And if you're doing none, then even just the smallest amount, you're the person who will benefit actually the most by increasing your physical activity levels by just a small amount. And the statistics around health prevention, if you're doing the 150 minutes, people who are active, so they do the 150 minutes a week, that reduces your risk by more than 20% reduces your risk of bowel cancer, breast cancer, strokes, diabetes, high blood pressure, depression, hip fractures in older people, dementia. So if physical activity was actually a pill that we could prescribe in bottles, then we would all take it, because the health benefits of it are insane. And it is something that actually it is accessible to all of us. Like a lot of medications, unlike a lot of medications, it doesn't have any negative side effects. In fact, it only has positive side effects, because it makes you feel good about yourself as well. You know, physical activity, if we do it in groups, can help us build social networks. And it is free, and it's free, and it's available to all of us. So just because I had a bit of time there, I thought I'd throw in a bit of advice about physical activity. And some more questions here. I think it's lack of understanding of what we define as physical activity. People automatically think they have to go to the gym, housework counts, playing with the kids in the garden, etc. Absolutely, 100%. If it gets your heart rate up, gets you a little bit sweaty, bit out of breath, it counts, whatever it is. Dancing around your living room. Strength in old age is overlooked. Absolutely is. My doctor used to tell me to slow down. You should swim or walk more, she would say. When my physio would say, no, stay strong and supple. Yeah, absolutely right. So we tend to have this idea that, you know, when our relatives or our friends or our neighbours sort of reach retirement age, that they should be kicking back, relaxing, winding down. Actually, that's not true. The opposite is true. We should be encouraging people who are in mid to later life to push themselves to do more, because it literally is true. If you don't use it, you lose it. You lose muscle. From the age of 35, we start to lose muscle mass. Women after menopause, during menopause, perimenopause, and after menopause, because of the lack of estrogen, start to lose muscle mass. And we also start to lose bone mass as well, which are really, really crucial for general good health. So yeah, we actually should be. And I once had an interesting conversation with a colleague of mine, a GP colleague of mine, and we were talking about this. We've been at a conference and we were talking about this. So, you know, if you're elderly parents or relatives, or you need their garden doing, don't go and do it for them. Go and do it with them, support them, help them to do it. So she actually said to me, well, I needed my kitchen repainting, so I actually got my mum round to come and do it. I thought it'd be great for our balance. Going to the community centre, basic, keep fit. Everyone responds to the music, but Black people respond even more to popular tunes we grew up with and start moving more. Style of music should be more inclusive. I do go to a gym, and I quite like to do the various different classes. But when I do the dance class, like the joy that is on people's faces, and I do the gym I go to, in that room it's predominantly women that do these dance classes. There is the occasional guy, but it is honestly women from the age of 18 to the age of 80. And people from all different ethnic backgrounds, and she's called Giselle, the woman who does the teacher, and she puts on a whole range of music, and she changes it depending on what's going on at the time. So on St. Patrick's Day, we did some Irish dancing, but also she puts on some African tunes, and she puts on reggae, and you do see different people responding to different types of music. It's really interesting. Okay, well, I think we'll wrap it up there. Thank you so much for having me, and I hope that was interesting. I hope it was useful. I'm sure people will watch this afterwards, and there will be lots more questions in the comments. So please do feel free to ask questions. I might not personally be able to answer all of them, but I will check in and answer a few of the questions, and I'm sure the team will respond to all of the other questions. So thank you so much for having me. Do have a look at what else is on the agenda for the virtual village hall. There's meditation, there's gentle exercise, there's mindfulness. So do check that out, and enjoy the rest of your week. Thank you so much.